Hi there, my name is Hunter, and today I will be performing administration of ophthalmic medication. I have my school badge, school appropriate scrubs, no fingernail, no polish, no jewelry. We'll go ahead and get started here. So, when administering the ophthalmic medication, we want to first start by verifying the provider's orders. And second, we want to verify the 6 rights of administration. So that's going to be right patient, right drug, right route, right time, right dose, and then documentation. Okay, so we've done that. Now we want to go ahead and verify the medication to the EHR. So we'll go ahead and do that next. Okay, so Timidol 0.25% solution. Okay, to be administered 1 drop per eye twice a day. Okay, so we've gone ahead and done that. All right, so next we would go into the patient's room. We would knock on the patient's door, shut the door behind us to ensure patient privacy, introduce ourselves to the patient, and in doing this, we can go ahead and perform our hand hygiene. Okay, hi Mrs. Smith, I'm Hunter, and today I will be your nurse. Can you go ahead and verify your first and last name and date of birth? Okay, and we would want to verify it with their armband. Okay, and then next, ask them if they have any allergies. Mrs. Smith, do you have any allergies? No? Okay, great. So then we would go ahead and, talk with them about the procedure and what our visit is for. Your provider has ordered administration of ophthalmic medication, so Timidol, which is for your glaucoma, and it's going to help with that intraocular pressure. Okay? Common side effects that you may experience are temporary blurred vision, burning, stinging, and possible itching. Okay? Any adverse effects, and these are going to be adverse effects are going to require immediate attention, as in we do not want these to happen, okay? So chest pain, swelling, or difficulty breathing. So if any of those occur, you please let us know as soon as possible, okay? All right. Do you have any questions? No? Okay, great. So we will go ahead and get started. Okay, so we are going to go ahead and apply our gloves here. Well, first, we should perform our hand hygiene again here, and then we'll go ahead and apply our gloves. Okay. Okay. All right, so at this point, we want to go ahead and make sure the patient is comfortable. So what we would do is we would go ahead and assist them into the supine position and or reclined position, whichever was appropriate for the patient. So we go ahead and lie them back. Okay, and then we would lower the side rails, raise the bed if needed. Right. So patient is comfortable. So what we're going to do is we're going to start by cleaning the eyes or the eyelids first before we administer the drug. When doing this, we never want to press directly on the eye. And so we will go ahead and get started with that. And we're going to clean from the inner canthia to the outer. Okay. So we'll start. Okay. Okay. And then we would get a new part of the cloth here, and then we would do the other eye. Okay, and then we would just dispose of that. Okay, are you doing all right? Yeah? Okay, great. So we would go ahead and remove our gloves, perform hand hygiene. I'm going to remove these, and then I'm going to reapply them because I only have 1 pair of gloves right now. So then we're going to go ahead and perform our hand hygiene. Okay. And then I'm going to go ahead, for the sake of this video, I'm going to go ahead and reapply my gloves. But in a real life setting, we would not reuse our gloves. Okay. All right, so we're going to go ahead and administer the eye drops here. So we're going to start by taking a tissue and we're going to put it on the cheekbone of the patient here, gently. Again, we never want to press on the eyes, but we're going to use our non-dominant hand and we're going to gently pull down a little bit, enough to expose the conjunctival sac, because that's where we're going to administer the medication. Okay, and then we would have the patient tilt their head back a little bit, and we would take our dominant hand, place it on the patient's forehead, and again, make sure, pulling down, making sure that the conjunctival sac is visible for administration. We'll go ahead and administer by making sure that we are 1 to 2 centimeters away from the conjunctival sac. Okay, drop, just 1, and then we would go ahead and dispose of that, and then for 30 to 60 seconds, we're going to go ahead and press on the lacrimal duct to avoid any systemic effect. Okay, for the sake of the video, I'm not going to do it for 30 to 60 seconds. All right, and then we would have the patient gently blink. Okay, and then we're going to go ahead and do it again with the other eye. Are you doing okay, Mrs. Smith? All right, so we'll go ahead again, gently pull down on the cheekbone there, non-dominant hand, placing the dominant hand, having the patient tilt their head back 1 to 2 centimeters into the conjunctival sac, drop. Okay, great. All right, and then we would again press on the lacrimal duct, 30 to 60 seconds to avoid any systemic effect. Okay, and then again, having the patient gently blink. Alrighty. Okay, are you doing okay? All right, so from here, our administration has been done. So what we would do is we would sit the patient back up, bring the arm rails back up, make sure that there wasn't any complications with the procedure and the patient was okay. Again, assuring that the patient is comfortable. And at this point, we would go ahead and remove our gloves, okay? Right, remove our gloves, and again, making sure the patient is comfortable and set. Excuse me. We would then perform our hand hygiene. Okay. And then we would go ahead and exit the patient's room and document the procedure.